the thought was that now, as we're starting a new era, is a great time to talk about what some of the priorities are of our candidates in what their objectives are in the legislature, whether it's a favorite bill or some things that they want to make sure happen for people in Maine. And further, for us to discuss with them what we can do to help make that happen. So who wants to start first? We haven't heard from Lydia yet. Are you on? And can you?
Yes, and I actually am double booked with a Moms for Gun Safety meeting tonight, so I would love the chance to talk, and then I'm gonna try to step out and participate there.
All right.
So thank you, Chris, and thanks to everyone. Bev and Drew, nice to see you both. It's great to be back, and it's an exciting day. It's an exciting week, and certainly an exciting year to be in politics, as I'm sure we're all feeling tonight after yesterday's mix of relief and exultation. So we're off to a great start. I've been assigned to the Marine Resources Committee, and we've gotten started just this week. It is fantastic to be joining the great work of really staying focused on our local marine environment and all the ways that the committee supports our state, and certainly this district. Representative Devon has done a great job, and I was really proud and grateful to be assigned to that committee to continue that legacy. While my professional experience is not in marine resources, I feel confident that I'm part of a team of folks, and already just meeting with the Lobstermen's Association, unions, the DMR this week. I think there are some great pieces and focuses that we really, you see in the media, discussion of right whales, offshore wind. There are going to be some hot button topics that we're dealing with, so I look forward to that. But I would really start, as far as a priority as a first term legislator, the best part of my job so far has been the constituent contact and the amount of communication I'm receiving from voters here in the district across party aisles, asking for help, sharing opinions and beliefs and what they want to see our legislature do in the upcoming 130th session. And to me, that's the best way for me to learn this job, is to hear from folks who voted for me or who did not vote for me, even better. And I'm learning a ton. I'm learning about why we have state funds in out-of-state banks. I'm learning about speed limits on local ponds and freshwater bodies. There have been questions about guardianship. There have been questions about speed limit enforcement on state roads. I mean, really, you name it. We've got folks who are really paying attention to what's going on right here in our community. And to me, that is at the heart of why I ran. And so I would encourage folks, if you have your own constituent concerns, I think you are well represented by all of our representatives and Senator Maxman here in this district. So I am here, I'm available. I know there's quite a lot of social isolation. I myself am I think I'm on day 6 of quarantine with my 5-year-old after some direct exposure in the public schools. And so I know that isolation is real, but I also know that there's a deep eagerness to stay connected with folks. And I would say that really, the state of this pandemic informs my main legislative priority, which is to see us through this pandemic. I know the rollout of vaccinations has been confusing. It's been inconsistent around the state and the country. I know some of that is determined by federal action, but I think that as a state, supporting a consistent and safe and thorough rollout of vaccinations is so important. For folks who haven't heard the news, I believe it's 70 and older can begin signing up for vaccinations here. You can go to Maine Health /vaccine or vaccination. Holly, maybe you have you can search and also on social media. But I was glad to see that, because I think, our frontline workers have been the first first to receive, and now we're ready to expand. And I think safety and health come as number one in 2021, followed pretty closely by our economy. Things are forecasted as looking a slight bit better than they did 6 or 9 months ago, but by no means are we in the clear. I think we have a strong focus on supporting municipal governments, making sure that towns are able to survive and thrive. We know that without municipal governments making it through, we're all doomed. I think public education is another huge area. I'm pleased that the governor continues to focus on expanding base pay, $40,000 priority for starting pay for teachers. I think that's, we've seen the importance of education. We've seen what a community foundation and core piece of supporting children and families, public schools, hold in our community. We also see the importance, along with vaccinations, of mental health care. I think as a clinical social worker, I'm certainly witnessing it, particularly with adolescents right now, but it's certainly not only adolescents struggling. I think we've all, it's been a long 10 months, and while we can hold on to the hope of vaccinations and some increasing safety in our communities, the emotional toll of the isolation and health concerns is significant. And I think it will continue to be even once we are back to quote unquote our regular routines. And I think prioritizing access to healthcare, access to affordable healthcare continues to be a focus. It's part of the platform I ran on, and I continue to believe in that. And it's a learning year. There's lots, I think, about COVID that's created a legislative session that's probably unlike any other, although I wouldn't necessarily know the difference since it's my first one. I will say I am lucky to have a really supportive group of representatives, both in our caucus and across the aisle, of really wanting to support one another and the work that we're doing. It's not an easy time, and I'm in it. I'm learning so much, and really appreciate the support of this district, the support of my peers in making it a good start to the session. I am happy to answer folks' questions. I also just want to say I'm always available. My phone number and email address I'll put in the chat box, but for anyone who's got any questions outside of the meeting, please reach out.
Phases of the moon in relation to the tidal cycle that you have up on the back wall behind you.
Yes, yeah, we track the full moons in our house. We may not be mariners, but we do pay attention to the ocean.
I have a question.
Yes.
You mentioned also that your child was exposed at school. I have been quarantined also. Tomorrow is my first day of back to work because I've been quarantined, I know, and I've tested negative. The first time I want to be negative. And I'm getting my vaccine tomorrow. However, my other educator friends are not getting it. And I'm not sure when they're going to get it, because we are at ages where we are more susceptible than anybody else. And with the new strand that's just coming in again, it makes it even so much more easier to contract the virus and get infected. So my question is, when are the teachers going to get sooner rather than later, before schools are closed? Because teaching in person gives me greater satisfaction, because these children need to be at school. Some of them have parents who are, especially in Portland, who do not have the paid sick time that they need it. Okay, and just now, this new year, we have for every 40 hours you work, you get 1 hour. They need 1 day or 2 days. So we're way behind. But that's my concern. We don't want to lose any teachers because we're already short in teachers. So when are we going to get it?
That's a
And
great.
in terms of education, please increase the funding to allow us to do more for the students. And it's not just to increase our pay, but to allow the students to get more opportunities to do more things that are more, life skills, rather than, being standardized test.
Yes.
Thank you.
Yes, yeah. So as far as teachers and vaccinations, I believe we're listed on 1B, which is the next phase for rollout. Although if you qualify under other, so if your age qualifies you for a vaccination, or I was lucky and privileged to qualify under my social work degree through medical providers. So there are some folks who are able to, which only increases the safety at schools. But I don't have a date, and I hope that 1B is, they are next on the list, is my understanding. I will say that working at the Bristol school, we've had 2 positive cases of folks in our school building, and we have not had the spread of any COVID within the school buildings. So quarantining works, masks work. We are, those cases are coming from outside of the school walls and being brought into school, and folks have not, and I know it's a tiny sample, but I am really, I feel very positively that, social distancing and masks really are effective, and schools, the Bristol school has been open 5 days a week since the start of school this year. And we've had 2 individuals test positive. Granted, we only have 250 people in our school building, but I think if you told anyone in the state of Maine or in this country, go walk into a building with 249 other individuals and how safe will you feel? We've not had any school-wide shutdown. So vaccinations are our future, are what we need. And we have practices that are keeping folks relatively safe. So, I'm grateful to have public schools supporting social distancing and CDC guidelines.
Thank you.
Thank you, Ina. Thank you, Lydia. Holly, you have some priorities you'd like to share with us?
Thank you. And thank you, Lydia. And I'll just pick up, I'll start by saying we've been having I serve both on the Health and Human Services Committee and the Government Oversight Committee this year, or this term. I want to say, I don't know what I'm thinking. I do sleep. For those of you who know a little bit about HHS, it covers everything from lead testing to nursing homes and everything in between, 2 state hospitals, more than 1/3 of the state budget. We usually have more than half of all of the printed bills. The last session, I remember we had 2,000 bills, which is a very daunting number when you start out thinking there's 2,000, we need to get to 0. But it's very, very satisfying because a lot of the work that we do covers the people who are most vulnerable, the disabled, the safety net programs, food insecurity, domestic violence, sexual assault, and a number of other things. A focus of our conversation today, we had orientation both with Commissioner Lambrou and with Dr. Shaw. And the good news is there's more federal resources coming. The unknown is vaccine production and how fast vaccine production will happen. I just have this fantasy that there's a stockpile sitting somewhere that's been held, and we're going to find out in the next couple of days. But even if we don't, we have a president now who's made a commitment to ensure that we're going to get vaccine production ramped up, and we're going to get it out to the states, including us. And Maine Health has done, and Lincoln Health are doing what they can do. And Monday, the field house at the YMCA here in Boothbay Harbor, which is enormous, will open its clinic. Watson Center is already doing clinics for people who see private physicians. You should still call those same numbers. I've directed people there, and I actually had somebody get an appointment today, so I felt like that was a tremendous success. But on Health and Human Services, we met all day. And some of the things that we're going to be looking at, some of the encouraging news that I'd like to share, and I made notes all over the place. It's been a very long day, trying to find them. Some of the things that I think are highlights is that in the governor's budget, there's a proposed increase of $45 million. And that $45 million is going directly to Section 29, which is supports. It also includes residential care for children and elderly and nursing homes. And one of the things that I spent last summer, I think we touched on it, I was on the Commission on Long-Term Care Workforce, which we have a tremendous shortage. We know that, but also we're underpaying people. We're not able to provide a living wage. When minimum wage goes up, that separation gets even further. So, and then without a rate increase, there's a greater burden on our healthcare system. And we just saw in Booth Bay, one of the greens closed here, Christmas week. So Booth Bay Green closed because financially they can no longer afford to stay open. So I'm glad we're beginning to have, the department has commissioned a rate study. We're starting to see some of the results. Rates have not been reset in 5 or 10 years. So all of the supports that exist in the community haven't been touched. So I'm encouraged that we're going to begin to do that. There's also some funding within the governor's budget to look at rates for people with intellectual disabilities and developmental disabilities. And I think about our friends at Mobius and all of the work that they do on a shoestring. Nobody's getting rich, we know that. But I'm encouraged that the governor has included some money in her budget towards that. There's also 7.5 million. Lydia touched on the struggle people are having with mental health, and it's true. I think we've all been isolated, sometimes forced to quarantine. And there's additional money for mental health and substance use disorder. And substance use disorder, we are seeing higher rates of overdoses and overdose deaths in Lincoln County and across the state than before the pandemic. So I'm encouraged that the governor has also addressed that, and $2 million for a new initiative to, it's called the Options Program, and it's going to be a very targeted effort to put outreach services in each of the county sheriff's offices. And I think that will go a long way towards, I do that work with the Booth Bay Harbor Police Department, but having it across the county is going to really help all of us and our loved ones who suffer with addiction. There's also an increase in the governor's budget. Lydia left too soon, of $45 million in general purpose aid to our schools. And in addition to addressing the $40,000 salary as a base salary for teachers, and I know a lot about that because my mom was a teacher. So I grew up with a teacher, and my heart swells big for anything to do with teachers because the sacrifices are enormous. But 45 million in general purpose aid and an increase, we always talk about, it seems like every biennium we talk about revenue sharing, and we keep, this governor particularly keeps moving the dial up. Finally, when it got set way back by the previous administration. And right now we're sitting at 51.78%, and we're going to move to 51.83 in the governor's budget, which it brings us up another click on the dial, and we're going to get back to where we should be. But this is the highest it's been in a really long time. So that's really encouraging. And the governor has also built a target of adding 61 million to the rainy day fund. And that will bring the budget, what is known as the rainy day fund or the budget stabilization fund, to 320 million, and it's never been that big. So for we went through a cycle of very negative press. I want to say that as Democrats, we've done a tremendous job at identifying resources at a time when we've been hit really hard by COVID. We had some very scary revenue projections. They're looking better, even out to 24 and 25. The revenue forecast is looking really positive. The biggest thing for us right now is the pandemic, and it has impacts all across state government. And there's no department, even, I think today we even talked about even the Department of Transportation, and they even have their signs with their suggestions that we all wear a mask and other things. Every state department is dealing with this pandemic on different levels, and we're dealing with it on the state and on our local level. And we're in this together. And vaccines, as was mentioned earlier, vaccines are the answer, but till we can get everyone vaccine, we still have to practice. We have to practice social distancing and masking. One of the reasons I'm meeting by Zoom. I'm not going to Augusta. There are people who are meeting in the committee room and they're making that choice. And that's their decision. But until it's safe to do so, I think we did a pretty good job today. It's really hard to sit for 7 hours on Zoom calls, but we did it. And we're going to continue to do it. As far as what I'm excited about, I am excited to hear there are some bills about wind power. We have a project that will be going in right through Booth Bay and East Booth Bay, through Acaventus out to Manhegan, which is exciting because it will bring some local economy dollars to my district, but also it will bring eventually a wind power project out of Manhegan that has had mixed reviews, but not nearly as many mixed reviews as some of the larger projects that are in the queue. But I think that wind power and using our natural resources like the ocean, the time has come to have those discussions. And I think we've tiptoed around it and it's been avoided or averted or just didn't happen in the previous administration. And now we're going to talk about it head on. And I think that's really important. Kelly just popped up a question. I did, too bad Drew's gone. I did put in a bill to expand $15 million bill to expand Medicaid coverage. As you know, I work for Lincoln County Dental and we did open November 9th and we're very excited and we are the only Medicaid accepting dental practice in Lincoln County. However, our rates, I'll just give you an example, and I brought it up to the commissioner today. We get $30 for an exam and cleaning. And I'm pretty sure all of you, when you go to your dentist, pay a lot more than that because I do. And there's actually in the commissioner's budget, a rate, there's a suggestion in the rate study that it be raised to the median of the commercial rate. So it's in there. There's a process to get it passed. And then, so my bill, I actually end up withdrawing because Representative Brooks of Lewiston also put it in. And I said, well, I will take mine out. I didn't sign on as a sponsor, but I will go to the hearing and I'll be in the committee room anyway and fight for this dental benefit that we desperately need. Maine is one of the few states that has horrible dental benefits under Medicaid. And I think we can do much better. About Medicaid, the other really good news, I mean, one of the highest priorities we had 2 years ago was Medicaid expansion. And Medicaid expansion currently, as of today, has 71,000 enrollees, which means that was the target. That was the number that we were shooting for. So you have 71,000 people who are now covered by MaineCare. And I think that speaks volumes about our values and how we care about the health of our people, and especially children under CHIP, which I think goes all the way up to 196% of the federal poverty level. We're covering more children than ever. We're covering more adults than ever. We've seen leveling off in the beginning when we went several years without any Medicaid for what were called single childless adults. You know, the initial healthcare cost kind of bumped up a lot because they hadn't had any healthcare for 8 years or 7 years actually, and it has leveled off. So the spending has come down into a, you know, and I think we'll continue to see that, but 71,000 people are now enrolled and many of them 2 years ago had nothing. So that's something I think we can all be very proud of. And I think we need to continue to ensure that Medicaid expansion stays in place. Now that it's in place, I don't think anything isn't threatened. And, you know, that's the unfortunate time. If you remember, I was the lead co-sponsor on the single-use plastic bag bill, which still is in motion. It did pass, it's still law. The governor it was supposed to be enacted in January this month, and it's been postponed to July just because of COVID. However, there are 4 Republican bills in to kill my plastic bag bill. So that's okay. We can fight some more because we don't need plastic in our trees or in our ocean. It wasn't a huge surprise. Well, I guess it wasn't a huge surprise that somebody wanted to do it. When I saw there were 4, I was like, now wait a minute. But that's okay. We got it last time and we're going to do it again. And I'm just trying to think. I have a few other bills. Some of them I think they're highly important and maybe be boring, but I worked for the department in 1994 when the AmHi consent decree was really, the wheels were really put on the bus and we started moving forward. And one of the things that drove it were the rights of recipients of mental health services. And if you've ever worked in or around any mental health, it is like the rule book. But no one's updated it since 1994, believe it or not. And there's some terms in there that just don't fit anymore. So I did put in a bill to update the language from 1994. It's critically important. However, it won't be anything, and I'm not so sure it'll be something really sexy that you'll see on the news. I have a very interesting bill that I'm actually, it's a department bill for DHHS that they asked me to sponsor. And it's working with Riverview Psychiatric Center and the Department of Corrections to make a statutory change so that highly dangerous patients who are found incompetent to stand trial, who are at Riverview Psychiatric Center, when they are dangerous, because there's been some recent incidents of very dangerous behavior, they can be transferred over to the Maine State Prison, to the intensive mental health unit, where they are safer and so is everybody else. That's a really important bill. May or may not hear about that. I think it's substantial because it's a statutory change, but it has a lot of impact for that workforce. I worked in state government for 2.5 decades, and I spent a lot of time at AmHi and then Riverview. I didn't work primarily there, but I worked with them. And I saw some tremendous injuries. And when you do that, you lose part of your workforce. You lose really good people, and they tend not to come back. So I think it's really important for the patients and for the workforce that it be a safer place to be. And I'm trying to think of some of my others. And for some reason, my brain is kind of dead right now, but we can have another conversation another time.
Certainly.
There's a lot of interesting bills. If you haven't seen the list, I could get it to somebody. If you have any questions about any bills, you can always call and write. I've also been flooded with calls about vaccine, and I wish I had all the right answers. I will say that because I work on the St. Andrews campus of Lincoln Health and I work around folks every day, I know that everything here is in full tilt, and they are doing everything they can do to make this happen as quickly as possible. And Kelly just posted the bills. And there's some interesting ones, and there's even a couple of really interesting ones about baby rabbits. So I will leave you to look at that one. Something about selling baby rabbits at 8 weeks instead of 6 weeks. I'm not sure what that's about. But I'm excited about the session. I think it's going to be incredibly hard to do this work in a platform like this. I'm excited about the time when we can actually go back together and do our work inside the House chambers, but I'm realistic that may not happen for us this year. Any questions? And I did get the amount. I just, I thought I got it. I tried to get the amount of the next round of pandemic funding we're expecting, but I don't have it.
Great.
There's a lot
Questions,
happening.
Anyone? I don't see any hands raised. You've covered an awful lot for us, Holly, and thank you for the work you're doing.
It's a busy time.
Yeah, for sure. And for the 7 hours on Zoom.
That's really hard. I'm gonna have to figure that. I don't know. I think it's time to go to a standing desk.
Yeah.
Anyway, thank you all so much.
Thank
It's
you.